So today we're going to be talking about COVID-19 and how it affects mental health. COVID-19, as we all know, changed the world. So I'll touch on that a little bit and what this new alternate reality is. I do applications for med school, and one of the applicants wrote an essay about how the world was different pre and post COVID. So because of that difference pre and post COVID, because of everything that now masks are prevalent, people know what social distancing means. Quarantine is a word which we never thought we'd hear again after the plague. But all that stuff really impacts mental health. And that's kind of why we see the effects we do today. And sometimes you don't even realize what a big effect COVID had on you. People have passed away, people have gotten sick, people have long COVID, and all that stuff really impacts us. We'll talk about how COVID affects mental health. I'll give you some resources. COVID has drastically changed the way we interact with our peers, with those around us in a work setting, in a family setting. The woman who does my hair, I'm getting married in a few months and she's not even coming because she's like, I have an immunodeficiency virus, and so I will not go to any public place where there is more than 10 people. She'll only dine outside. And because of that, because she's so immunocompromised and she's still so scared about getting COVID, she won't go to any restaurants for the rest of the winter. And that's something that somebody who's a frequent restaurant goer, but now can't go to restaurants, that impacts your mental health. And so this is just a slide to highlight the ways that COVID has changed our lives. We now hand sanitize a lot more than we used to. We wear masks now. In some places they're mandated. If you still go into a lot of cancer hospitals, you've got to wear a mask. We talk about social distancing, so we're farther away from the people we love. I remember hugging and sharing drinks was a lot more common. And these are all things that significantly impact mental health. And it starts at a really young age. If your child is sick and they're found to have a fever in school, or somebody sees them coughing, they might send them home. Whereas before they might have stayed, and everybody worries like, oh, that kid COVID. And so it's kind of become like the cooties. Everybody stays away from people that have COVID. But that really takes a toll. A lot of times, again, it's subconscious and you don't even realize how it's impacting you and how it's changed your life. But I'm sure we all know somebody who's gotten sick from COVID too, and how that's really changed their life. And my dad's aunt actually passed away from COVID. And so that's a huge thing that, like, I'll never forget what COVID is. You know what I mean? And the saddest part was when she was in the ICU, nobody could visit her to say goodbye because she had COVID. And so it's really tough. Everyone has their own COVID story. Everyone learned something new about themselves. But now that we're years after COVID, it's how do we tackle those mental health issues and how do we meet the needs of our communities that have been impacted by COVID? How COVID affects mental health. So one of the biggest things with COVID is COVID led to isolation. You have to quarantine. Initially, you had to quarantine for like 2 weeks. Now it's a lot shorter of a time period. I was reading a couple of studies, and the biggest thing is, especially in the adolescent population, our teenagers, kids in high school that were in middle school, that's a very formative time in a child's life where they learn how to interact with other children, how to do teamwork, how to go to school in a social setting, how to be a functioning adult when they grow up. But if they missed out on that time because they did Zoom school for a while, then they really struggle with that. And so it was saying that the rates of anxiety have significantly shot up since COVID in the adolescent under 13 population. And that's something that directly correlates to COVID-19 and when it started. That's something that we should be aware of. COVID can present with, like, especially in the adolescent population, the anxiety, the phobia, the stress, the shame of, oh my gosh, I have COVID. A lot of kids were bullied after getting COVID, especially if they were from certain ethnicities. The Asian American population especially, there was a lot of bullying that went on in schools too. And so in my school district where I grew up, there was a child who was like punched in the face to the point where they accidentally fell down the stairs and had to go to the hospital. And it was because they were Asian, and the person said, oh, you started COVID. And my mom got sick from COVID. And these were like middle schoolers. And so that's a really big toll that takes on somebody's life, and they live with that forever. COVID really exacerbated these fears in adults, in children, especially people who had a COVID scare in their family. Their families might not let them go on play dates without checking COVID status. So for example, one of my little sister's friends, before she goes anywhere, especially for like a sleepover, the kid has a COVID test. And then before she comes home, she also has to do COVID test. And the good thing is we have a lot of resources that enable that to happen. And we can frequently test. We can all get vaccinated. We can wear masks and even social distance. It helps show that there's a lot of options that we can take. There's a lot of things that we can do to prevent COVID. Caring for your mental health during COVID. During COVID, it's really important to, one, especially when you had COVID, two, if you are getting over COVID, unfortunately, there's so many people who have long COVID. COVID isn't something that comes and it's like the flu 24 hours later, you're fine. Sometimes you're kind of lethargic for a few weeks. Sometimes you don't feel good for a few weeks. And so all of that plays a role in why COVID affects mental health so much. So this is kind of during the pandemic era, this was more applicable, but to know the facts, knowledge, power, and knowing the facts is super important because maybe rates aren't as high. Maybe if I am vaccinated and I am wearing a mask, I'm less likely to get COVID. And that kind of makes someone feel safer. There's a lot of things that like, knowing the risk and knowing what can lead to an outbreak, what can predispose somebody to getting COVID, how we can treat COVID, the fact that we now have treatment to mitigate the effects of COVID. There's vaccines that are now out, but as always, there is anxiety. So to remember that you're not alone. To remember that there's family and friends who are just a phone call away. One thing that I think is important to talk about is that if you are family or friends of somebody and you know somebody who has COVID, maybe just to reach out and be like, hey, how are you doing? And it's especially tough if somebody's like immunocompromised and they've gotten COVID multiple times. Then they're like, oh my gosh, why do I keep getting COVID? So just to reach out to those around us and an ally and the support for those around us. But exercise, take care of your body. Sometimes when you're quarantining now that we work from home, ensuring that we still have that daily movement, that we're still taking care of our bodies, that we're feeling appropriately. And so those are all really important things to help make the effects a little bit less. In terms of asking for help, if your feelings get too overwhelming, that's what we're going to kind of talk about the resources. Yes, you have your family. Yes, you have your friends, but healthcare providers are here for a reason. The resources that I'm about to talk about are not only for COVID. They have specific COVID programs for people that have gotten COVID, especially with like group therapy sessions. However, these resources are for anyone who's struggling in any facet of life. Your mental health is important. I know as a provider, like I'm a resident right now, but I promise to like try to ask all our patients about mental health. So the first research we talked about is the NIH, the National Institute for Health. They have resources in English and in Spanish, but if you search up like NIH Health and Mental Illness in like Urdu, there's a page that will come up too. It's not on the main website, it's only English and Spanish, but you can type to find it in a different language, which is really cool if you guys speak something else. But in terms of where can you get immediate help? So if there is a life-threatening situation, suicidal ideation, depression, but to get immediate help, if you ever are in a situation where you feel like you're stuck and you're in a suicidal or emotional distress, there's a 988 suicide and crisis lifeline. It's 24-hour support. It'll connect you to a trained counselor and you can reach specialized counselors. So you can, for LGBTQ, if you text you to 988, or if you press 3 after calling 998-988, and that's the subgroup that's mentioned on the website, but there are other specific types of subgroups. So if you fall into one of those categories, there are options and kind of numbers you can dial to help streamline the process. But if not, they'll connect you to an operator and the operator can connect you to the correct professional so that you can. There is also for social media, there's safety teams for every social media website. And so if you click that link or just search up Instagram safety team, you can report something. It's our responsibility to make sure that we are on top of this. If you see something, say something, that's the big thing, and to go from there. But with COVID too, people around COVID, a lot of kids are made to feel like, COVID, I'm quarantined, I have to do these. And so to kind of make those around us feel a little bit less like there's something, like if you are done with your quarantine period, to have the knowledge and to educate those around us that you are no longer contagious and that the person who previously had the virus is able to interact safely with others. The continuing on that, how to find a healthcare provider or treatment. There's therapy, medication. You can always use a combination of the local resources. I'm based in New York. There's a New York State Office of Mental Health, but there's also the Mayor's Office of Community Mental Health. There's a whole guide, and so there's a study that showed that after COVID-19, rates of substance abuse went up. So there's a special division, special funding that the New York City Mayor's Office get to work with mental health and substance use. And it's not mental health only limited to substance use, but it is mental health related to substance use that can also be due to COVID. And if there are special programs for mental health related to COVID. And then 988, again, that special number is the confidential crisis counseling mental health line. And that can be for substance misuse. That can be if you have COVID and you're isolated, you having a lot of emotions and you just want to talk to somebody. That's a 7-day-a-week, 24-hour phone line that you can reach, that you can text to, because sometimes it's hard to talk to somebody and it's easier to text. And I know, especially during COVID, you don't want to talk to anybody. You'd rather just text somebody. So that's a text as well. And then there's the chat line too, that you can chat with somebody. Long COVID is a thing that exists. So it's not you had COVID, it goes away. A lot of times people have coughing or breathing problems, smelling sleep, trouble sleeping, brain fog. And that brain fog can also predispose somebody to developing mental health issues after COVID, because you're feeling more anxiety, feeling frustrated, they can't perform at the level at which they used to perform. Therefore, their mental health is negatively impacted by it. And so these long-term symptoms of COVID that we're just rehashing on and doing again are just to remind you all that they do exist. If you are having them and you would like to see a provider, please do. And people who are most at risk are usually people who are not vaccinated. This is just information on how to stay up to date on vaccines. So there's boosters, there's a new 2024 booster available, and it's the 2 doses of Moderna and the booster of Pfizer for anyone who has never been vaccinated. So if you have been vaccinated, you can do a booster. That's flu season, so please everybody get your flu shots. There's a ton of places for us to get vaccinated. A lot of these are free, so don't feel burdened if you're worried about not seeking help because you won't be able to afford it.
Therapy, I recommend it literally for everyone. And it also is just a reminder that if you aren't feeling like a therapist is a good match for you, you want to kind of trial and error and find a good therapist for you too. And not all therapy is all the same. So there's different things that are individualized to what you're experiencing. So there's a lot of therapy and mental health resources you can get through those websites. And then also just through your primary care doctor, wherever you get primary care, you can always ask them about mental health and getting a therapist.